Hi, I'm Dr. Jacob Teitelbaum, and today we're going to talk about how to cure indigestion naturally. Do you have stomach burning, acid reflux, feel miserable after eating? Are you burping up food and the taste of food of stuff you ate hours ago that should have been long gone from your stomach? Are you addicted to antacid medication and acid blockers? Well, today we're going to teach you how to restore healthy digestion naturally so that you'll no longer need the antacid and other medications. Now let's start by taking a look at the cause of indigestion. The drug companies have helped to misinform people to make it sound like it's because of too much stomach acid, but this is not the case. If you look at it, people make less stomach acid as they get older, but they have more indigestion. Indigestion is not too much stomach acid. It's simply poor digestion, usually because of too little stomach acid and too few digestive enzymes. When this happens, the stomach will hold on to your food sometimes for hours, and you'll get burning and reflux. And at that point, any acid will cause pain. When you turn off the stomach acid, even though you have too little acid, it turns off the pain, and you don't feel so bad, but meanwhile, you're having trouble digesting your food. In addition, when you take the acid blockers, your body makes a hormone called gastrin that is yelling at your stomach to increase acid production. And because of that, when you stop the antacids, you get the Niagara Falls of acid coming into your stomach, and you feel like you're going to die. So we're going to talk today about how to come off the acid blockers naturally. Number one, why do we have an epidemic of indigestion over the last 40 years? Well, it's occurring because the food processors learned that by destroying the enzymes that are present in the food, which are what naturally ripen the food, you can increase shelf life. So for example, an ear of corn may have a 5-day shelf life, but when you destroy the enzymes and turn them into cornflakes, the shelf life could be 5 millennia. They look good, but they're indigestible. So they destroyed the enzymes, which are easy to do, and the enzymes that ripen the food also do the digestion of food in your stomach. Your body makes extra enzymes in the pancreas and salivary gland, but it's not enough to take on the whole job of digestion. So I recommend you begin by taking plant-based, animal-based ones don't work, but plant-based digestive enzymes with your meals. And also add a little bit of vinegar, apple cider vinegar or whatever, maybe a teaspoon to each meal to help digest the food acting like stomach acid. In addition, a very nice and simple way to heal the stomach ulcers would be to use a natural product that helps kill the bacteria in the stomach called H. pylori that are associated with ulcers. This can be done using a natural product called mastic gum, 500 to 1,000 milligrams twice a day for 1 to 2 months. In head-on studies, mastic gum and also DGL licorice, basically licorice, are as effective as Tagamet. You can use one or both of them together, again for 2 months. After you've been on the mastic gum and DGL licorice for a month, I recommend switching from your more powerful antacid medications like Prilosec or Nexium to Tagamet, which is milder and only partially suppresses stomach acid. And then over the next month, slowly lower the dose until you're able to wean off. After 2 months, you can usually stop the mastic gum or licorice, and these can be resumed as needed, but stay on the digestive enzymes, especially with larger meals. When you do this, not just will you have less indigestion, but you will digest your food more effectively, getting much better nutrition. You're going to feel better and have less degenerative disease as well. So this is Dr. Jacob Teitelbaum, teaching you how you can digest your food healthfully and wishing you great health.